You've just finished a review into the mid-staff experience. What do you think the essential value add of the triple aim is so that this experience is never repeated?
Well, the triple aim is about three things and then integration. The first is improving the health of a population. So it's really, as I've been discussing, looking at the whole of what health means. The second is the experience of care. And the third is cost per capita. And it's integrating those concepts. I think at mid-staffs, what happened was that the leaders there were focused on cost, driving down expenses, and they were blind to the other two parts of the triple aim. They certainly were not looking at health, and they were ignoring the experience of care. And I think that's a pitfall.
Yeah.
That's a risk always, and I think that's why the triple aim is so important today.
Yes, and the impact of acknowledging everything about the patient care and the patient experience, the impact on staff must have been horrendous as well, as they observed all of this.
They observed it, they tried to call out,
Yeah.
they were ignored, and I think the culture there changed them not only as professionals but as people.
Yes.
I think it made them numb to the pain of another person and to each other. And I think the culture was one of a very toxic and dehumanizing climate.
Yeah. Thank you for that. In a blue sky world, how could we best create an embarrassment of riches of leadership in quality worldwide?
There is a bit of work that we need to do in building capability, but I have incredible faith in the young.
Yeah.
I think you might know that a few years ago we launched the IHI Open School to engage medical students, nursing students, healthcare administration students in learning about improvement and innovation. And today we have about 151,000 students around the world.
Wow.
in this program, and I am so inspired by them. They learn with each other, they learn from each other, they learn from patients. There's a group of them here that I met with earlier today, and I feel so much faith and confidence that building the capability in the young is going to make healthcare much better when I need it.
Yeah, and if we're open enough, they teach us as
Yeah,
well.
absolutely.
Yeah, okay, thank you. What can we learn from the Virginia Mason experience in applying the Toyota production system principles? You spoke about this in your book.
Yes, I was just there last week and was walking through both the physical plant and talking with staff about the culture. The physical plant is just breathtaking. They've really designed the hospital with the patient in mind. And so when you go to visit a patient room, as an example, they've looked at what do patients need in order to heal. They need peace, they need quiet, they need a confidential place for conversations. So when you walk into a patient room, it's very inviting and it's very quiet. All the supplies that in most hospitals get trucked into the room several times a day are all loaded through corridor access so that you don't have a whole lot of traffic into the room. It's very respectful of the staff. Instead of making them walk the whole length of the hallway to get supplies, everything's located so that it minimizes their steps and maximizes their time with patients. The physical plant itself is breathtaking, but they also pay incredibly careful attention to the processes of care. And I was in a patient room where they were talking about patient engagement on the journey, which is a different way to look at lean. And in each patient room, depending on the diagnosis, I was looking at a hip and knee replacement graph. There's a ladder, and it will say things like, you've got to be able to sit up on the bed by yourself. You've got to be able to get up and go to the bathroom by yourself. You've got to be able to take a shower and walk to the end of the hallway and eat comfortably. And it's represented as a ladder, and the patient can check off as each one of these activities is conquered, and they can see their pathway home. And it's changing the whole dialogue between the patients and the staff. Patients are saying, hey, I'm already at the top and I'm ready to go home. And they're basically taking control of their hospital stay.
Which goes back to your original comment about empowering people and empowering patients.
Absolutely.
So they can see the end result of being able to go on and go home and continue life a more healthier person.
It's changed the whole conversation from a patient saying, well, I think maybe I'll wait till tomorrow to get up. But when they see the pathway,
Yeah.
they're taking control.
Yeah, well, that's
It's wonderful.
great. That's fantastic.